Very good evening, friends. Meeting again in the session of Materia Medica. And today we're going to learn a small remedy from our Materia Medica, the third year syllabus, but very important in practice, that is Croton Tiglium. A remedy having very specific action on GI system as well as skin. And this remedy I have utilized specifically in summer weather, and now summer is going on. The role of this remedy always is there with the summer. I will share a case and then we'll learn it from the Allen's Keynotes. What has happened? It was nearly about 7-8 years back. There was, during summer weather, there was a case, young fellow around 20-25. He came suddenly with a severe acute diarrhea. Diarrhea was very forceful, watery, but not so much painful. And it was a summer, so painless diarrhea during summer, profuse, and just because of little bit change in food habits. And when it was painless, I have considered it's a common remedy we used to use, the podophyllum. So I have given the podophyllum 200 few doses to him. I asked him that to meet me next day. What has happened? Next day he came. His diarrhea was little bit better, but not completely stopped. But he was getting a little bit rumbling inside the abdomen, a swashing sensation, and he developed a rash all over the body. So I have reconsidered the case, and then I asked, how is the diarrhea? He said, sir, it is watery, little bit blood I have observed over there. And second thing, the rash was there. The rash was typically at the certain fold levels, it was vesicular eruptions. And he was itching, it was itching so much. So that was, then I considered it is not podophyllum. Podophyllum is having a painless, profuse diarrhea, changeable character, etc. But skin rash never alternates, or skin rash never develops over there in case of podophyllum. And then I have considered about the Croton Tig, because it is the second remedy one should think in summer diarrheas. Associated diarrhea alternating with or associated with skin rash is the Croton Tiglium. Second important thing is that the typical sensation, a squashing sensation, as if the fluid is passing through the intestine, that typical sensation is very important in the Croton Tig, which is there. The pain is not so marked, but swashing sensation is more. And third important thing, the gushing diarrhea, very forceful. It was very forceful. So these are three important characteristics, along with severe skin rash, which are of a vesicular character. Vesicular character rash comes in very few remedies. One of them is Rustox, second is Apis mellifica, this is third one. Dalkamara sometimes you can get over there. But this specific remedy, there is an intense itching. Even this remedy is, in certain cases of rust poisoning, this remedy can be utilized for it. So it was of a Croton Tig, and I have given just Croton Tig 3 doses of 200 potency. Croton Tig, after Croton Tig 200, his diarrhea immediately stopped. There were no further diarrhea stool. Next day he passed normal stool, and rash, it took nearly about 3-4 days, 4 days, 5 days to subside, but it gradually vanished. Itching was stopped, but rash, it gradually tapered, and he recovered completely thereafter. So Croton Tig is a very important remedy, specifically in this summer season, in where the diarrhea, gushing diarrhea associated, profuse gushing diarrhea associated or alternating with skin complaint, where the rash is of a vesicular eruption, specifically about the genitals, more commonly around genitals. This remedy is a wonderful remedy to be think of. Second important thing, one can think of this in even in bacillary dysentery. Croton Tig is a good remedy. But generally, in bacillary dysentery, the toxicity is more marked, which you cannot so strongly get with the Croton Tig. But bacillary dysentery, where the fever is not a characteristic. This remedy is a wonderful remedy, specifically in summer season. So this is the remedy which we will going to learn from the Allen's Keynotes. Let us open the Allen's Keynotes. It is a remedy from plant kingdom, vegetable kingdom, Croton oil seeds. Dr. Harman from Germany, he has proved this remedy. The family is Euphorbiaceae. Affects the mucous membranes of the intestinal tract, producing transudations of watery portions of blood, a copious watery diarrhea. Transudations. Transudation means a fluid which comes out of intestine in the fossa, which contains less amount of proteins. Exudation, where the protein is more in quantity, exudation happens generally in inflammatory conditions. It is not so marked inflammatory condition which you get in this remedy. That's why here you get the transudation with a profuse watery fluid. So water is thrown away, producing transudations of watery portions of blood, a copious watery diarrhea like veratrum album, and develops an acute eczema over the whole body. Acute eczema, very close to the rus. Rus is also having vesicular eruption. Rus rash is having erysipelatous inflammation over there. Apis is having erysipelatous inflammation associated vesicular eruption. This is one more remedy where you can get the vesicular eruptions. So this is a typical acute eczema which you can get over there in Croton Tiglium. The bowels are moved as if by a spasmodic jerks, coming out like a shot, gambogia. Yes, gunshot diarrhea or very profuse shot like diarrhea is typical of Croton Tig and gambogia. As soon as patient eats, drinks, and even while eating, yellow watery diarrhea. So this is so strong that patient wakes up from the while eating and he goes to the closet to pass the stools. It is so acute. He cannot control. Immediately he has to rush for toilet. This is very typical. Stool quality is very important. It is watery, yellowish stool. It is close to the podophyllum also. Podophyllum also have more commonly, but podophyllum, the color is changeable. Constant urging to stool followed by sudden evacuation, which is shot out from the rectum. Gambogia, gratiola, the podophyllum, the thuja, these are the remedies which are for such type of gunshot diarrhea. Swashing sensation in the intestines as from water before the stool. So there is a typical sound of water which is running in the intestine or going ahead in the intestine. That sensation is called as the swashing sensation. Rumbling is a spasm which develops in aloes. Aloes, there is one important thing. Aloes patient have a more, it is not more diarrhea, it is more dysentery. Second important thing, before, during, and after stool, there is a very spasmodic pain. That is what is called as crumbling. There is sound which is produced because of it. At the same time, the spasm which has been produced by it. So aloes, patient complains that there is a very typical spasm, murda marun yeto. That's what the in Marathi they label that. That is a very typical spasm which happens to be there before stools. Drawing pain through the chest from the breast to the scapula of the same side every time child nurses, nipples very sore. Very, very, very characteristic symptom of this ailment. I have treated a case way back. It was very big back, 1995-96. This remedy I have used for this same symptom because that patient was not getting settled, and there is no. Everyone was telling the patient that what you are telling it is psychological. She used to tell that doctor, I am getting the pain behind this whenever I used to feed my child from the same side, and she was complaining it in whatever side she used to feed, she used to get the scapular pain. And doctor said there is no relation of the your breast nipples and the scapular pain. So forget about it. Just take painkillers. If you have severe pain, then she was treated with painkillers. She was treated with tranquilizer, and she was not getting the result. And she was brought to me. So this typical characteristic symptom is mentioned in Croton Tiglium. I have given Croton Tiglium to her 30 potency in repeated doses for a period of week. And thereafter she came and she said, doctor, absolutely better. No more pain. It has stopped instantaneously. So this is very important symptom, very characteristic symptom. Generally, the things which are not logical are always characteristic. These are called as a rare. These are called as a you can call that as a queer symptoms, and which are very typical. They, logically you cannot correlate, but they are present. These are called as queer, PQRS, queer. Queerला आपण मराठीत विचित्र म्हणतो, which are called as queer, which where there is no logical correlation, and this is there with this remedy. So one should not forget, the nipples are sore and pains are radiating to the scapula. Intense itching of the skin, severe itching, but so tender is unable to scratch. There is severe itching, but whenever he tries to scratch, it is so painful. Tenderness is more marked. It is inflammatory. It is eczema, acute eczema. And in eczema, there is always a thickness and tenderness. Eczema is a disorder. It is a cyclical pattern of disease which starts with papule. Papule leads towards the vesicle. Vesicle ruptures because of scratching. An ulcer develops. Ulcer heals with lichenification, means thickening of the skin, and again on lichenified area, a papule develops. This cyclical pattern of disease is called as an eczema, where there are vesicular eruptions as well as the papular eruptions with a ulcer, with a scratching, and it becomes tender. Then that is very typical of this remedy, that is Croton Tiglium. This eczema is better by gentle rubbing, eczema over whole body. So it is not specifically to for certain parts, all over the body, the eczematous pattern happens. Intense itching of genitals of both sexes. Genital itching is very characteristic, like rust ox. Rust and croton cups at skin level, they are very close to each other. And the podophyllum and Croton Tig cups more at the closer at the GI features. Vesicular eruptions on male, so sensitive and sore, is unable to scratch. Cough, this is another third important thing one should not forget. Cough as soon as the head touches to the pillow, spasmodic paroxysms of cough set in. Asthma as soon as head touches the pillow is grindalia. Here it is the cough as soon as the patient's head touches the pillow. And this is patient cannot sleep in lying down position. He has to sit. That is very important, or he has to stand. Paroxysms of cough sets in, suffocated, must walk about room or sleep in a chair. This is very characteristic of this remedy. Relationship, compare calibrum and phosphorus in chronic infantile diarrhea. Phosphorus is also having gunshot diarrhea. Phosphorus, as if stools are passed as if from bunghole, that is typical of phosphorus. But if phosphorus is having hemorrhagic diathesis more commonly. Calibrum, you can get over there the similar type of diarrhea, but more mucoid quality. Cilicia, pain from nipple through the back when nursing. Cilicia is one more remedy. Modalities, general modalities. Aggravation of diarrhea, aggravation by every motion, aggravation after drinking, aggravation after eating or nursing, like argentum nitricum and arsenic. Aggravation during summer, very important. Keep it in your desktop, this remedy always during this summer weather, other than podophyllum. Aggravation from fruits and sweetmeats. Sweetmeats means mithai khana, sweetmeats. Gambogia is another remedy which is for the same aggravation. Aggravation from least food or drink. So patient eats little bit and there is a diarrhea. Very simple, important modality of the Croton Tiglium. This remedy follows well by rustox. So if you give the Croton Tig, it is well followed by the rustox. It antidotes the rustox, and this remedy is antidoted by antimtat, anacardium, clematis, rustox, and ranunculus barbosus. 5 remedies. These are remedies which happens to be there, which antidotes the Croton Tig. Action is 30 days. It is not so acute acting remedy. Action is nearly about 30 days. Amit, you have asked the please differentiate acid force diarrhea with Croton Tig. Yes, acid force diarrhea, again, a very marked debility is associated with acid force diarrhea. Debilitated condition, which is very marked with the acid force diarrhea. That debility you cannot catch over here. Here the profuse diarrhea is there, but patient is not so much debilitated. There is severe craving for fruits or fruity juices, fruit juices in acid form, which is not so marked in the Croton Tig. So basically, at the particular level, you cannot differentiate, but at the general level, you can differentiate the acid force from the Croton Tig very easily. Acid force has indifference. Patient gets a diarrhea, patient gets a suffering, he gets debilitated, and many times the old fellows who used to get affected in acid force, and generally they becomes indifferent, all of a sudden indifferent. They cannot recognize the people. So this is very typical quality of acid force which you can catch. I have seen one patient for whom I have called in the home visit because he was not able in a condition to bring to my OPD. He had a fracture neck femur and he was in bed and he was lost everything. And the physician asked them to call all other relatives that he will not going to survive. His age was 85 and everything. And when I went over there, I have seen, I I tried to talk to him, but he never recognized his children, everyone. And then that severe debility was there. He doesn't have a strength over there, and he had 3, 4 loose motions and severe debility. So I have given this remedy 3 doses, acid first, 200, 3 doses. And he slept whole night after giving acid. When he waked up from the sleep and he observed everyone was present in his room and he asked, why all of you are there? What's the matter? See, this is a very important thing which he has mentioned over there. That is that the indifference has vanished with the acid force. Very characteristically. So that is this is how we can differentiate. Second, yes, there is Dr. Thorath has asked that how to compare with the Dalkamara. Dalkamara, generally, Dalkamara is having aggravation not during summer, but Dalkamara, it is having very specific aggravation during the damp, rainy weather. That is very characteristic of Dalkamara. Dalkamara, the generally symptoms are there. The skin symptoms alternates with rheumatism is important, or skin symptoms alternates with dysentery more important. Generally, the features are more of a mucoid type of dysentery in case of Dalkamara than the severe watery diarrhea of the Croton Tig. So that's the very important difference which you can easily catch over there between the Dalkamara. And Dalkamara generally it has been shifted sometimes or many times to the rheumatic complaints. So it's easy on the general features of the remedy to differentiate the Dalkamara from the Croton Tig. So a very important remedy which we have learned in today's session. Tomorrow we'll continue with the next remedy. Till that period, if any queries are there, you can put it in my chat box so that we can discuss. Any other query?
Sir,
Yes.
sir, can we give Bryonia 200 for a week? You
To
symptom matching. Sir,
Briania 2
Bryonia 200
for
can
whom?
repeat it for a person who is having moving problem.
You can give Briania, you can repeat in low potency 200 potency, you can repeat for a period of 3, 4 days, you can repeat, or even for a week, you can repeat.
It will not bring any harm. No?
Yeah, yeah.
It will not
But
bring any harm.
yeah.
Thank you, sir.
So thank you. We'll meet again tomorrow.
Hello,
Good
sir.
night.
I have one this thing. Hello,
Huh?
sir. I have one question. One
Yes.
of the keynote of acid wash, no, sir, it is showing that all discharges are profuse and debilitating except diarrhea. So, can you please explain this?
In Allen's, it has been mentioned. In Allen's,
Sir, I saw this homeopath firefly keynotes.
okay. Acid force is a remedy where general debility is there. It happens to the debilitated person already. That is very, very characteristic of acid force. It is not only diarrhea which is causing debility in acid force. Acid force in general is the person who is debilitated. Generally, acid force is the remedy for the diabetic fellows who are more commonly debilitated. And that's why debility never develops because of a diarrhea. It is originally the debilitated person who develops the diarrhea over there. And that's why it is not causing the diarrhea. Diarrhea is not causing the debility over there. Okay.
Okay, sir. Thank you very much, sir.
Indifference to someone have asked, what is the question? Indifference in general, indifference to suffering. Indifference means udasin. Indifference means they are not at all considering what is happening around them. It is indifference. Marathi, it is very simple to understand. Udasin banna, it neutral. You cannot understand who is there. Indifference to pain. Not there is a severe pain, but they are indifferent. They are not able to get that or feel that pain. Is the indifference to the pain. So you can see that the patient is having severe inflammation, absolutely red, but patient is not complaining. That is what is called as an indifference to the pain. Or sometimes patient comes to you, he's suffering from rest of the thing, and he tells you certain things, and at the same time there is one more future which is there, and then you ask why you have not told this. Then he says, it's okay, I feel that it is there since long time. That is indifference to suffering. So this symptom comes in many remedies, indifference to the suffering. So thank you being there, and good night. We'll meet tomorrow again with a new remedy.
Thank you, sir. Good night.
Okay, good night.